Hello everyone, here we are going to discuss a very important topic, that is tumors of kidney. So basically we will be discussing two tumors of kidney here, the tumors of kidney in adults and the tumors of kidney in children. In adults we will be discussing renal cell carcinoma, that is RCC, and in children we will be discussing Wilms tumor. So in your university exam you usually get a long question on them, very frequently you get long question on them, either on renal cell carcinoma or on Wilms tumor. So let's start it, the topic that is tumors of kidney. Here you can see we are starting the topic tumors of kidney. So first I will be discussing the classification, the overall classification of tumors of kidney. Then we will start one among them, that is the most important tumor of kidney in adults, renal cell carcinoma. And after that we will start the tumor of kidney in children, that is Wilms tumor. Both of them, the renal cell carcinoma as well as Wilms tumor, we will be discussing under the same headings. I will let you know the introduction, most common age of presentation, the gender prevalence, the gross, it arises from microscopy, mutations, clinical features, spread and prognosis. So I will be telling you these things in both of them, and in the end we will compare them in a comparative manner. So let's start the topic. First of all, let me tell you the classification of tumors of kidney. So here you can see the overall classification of tumors of kidney. We divide the tumors of kidney into 5 categories. The tumors which arises from epithelial, these are known as epithelial tumors. The tumors which arises from the epithelium of the renal parenchyma, the tumors which arises from the epithelium of the renal pelvis, the tumors which are embryonal in origin, the tumors which are non-epithelial, and the tumors which are metastatic. Among them, we will see, so the tumors which are arising, epithelial tumors from the renal parenchyma. The malignant among them is adenocarcinoma. The benign one is adenoma. We will not discuss adenoma. We will discuss adenocarcinoma, also known as renal cell carcinoma. It is the most important tumor of kidney in adults, in adult human beings. And one of the embryonal tumor we will see is nephroblastoma. The benign version is nephroma. We will not discuss nephroma. We will discuss nephroblastoma, also known as Wilms tumor. It is the most common tumor of kidney in children. So please learn the classification thoroughly, and after learning the classification, we will see the details of the two. So first we will see renal cell carcinoma. As I told you, it is the most common tumor of kidney in adults. It is also known as hypernephroma. Why it is known as hypernephroma? So this is the kidney. This tumor usually occurs at the upper pole of the kidney. So this is the kidney. This tumor usually occurs at the upper pole of the kidney. That's why known as hypernephroma. So it is the kidney, the tumor is present above the kidney. Hyper means above. It is present above because it is present at the upper pole of the kidney. That's why it is known as hypernephroma. It is the most common malignant tumor of kidney in adults. Most common age of presentation is 50 to 70 years. It occurs relatively old age, and it is more common in males as compared to females. So learn the introduction, learn its other name hypernephroma, learn it is the most common tumor of kidney in adults, and learn the age, learn the gender. After that, coming on the gross, how does it look like? So can you see a diagram of kidney in front of you? This is the kidney. Now in this kidney, can you see where is the tumor? This one is the tumor. It is present at the upper pole. So usually the tumor is solitary, single. It is unilateral, involving one of the kidney, either right kidney or left kidney. And it is present at the poles of the kidney. Usually it is present at upper pole. Usually the tumor is golden yellow in color and it is well circumscribed. So this is the gross. So typical gross you have to draw in your exam. Draw a kidney. In that kidney, draw the tumor at the upper pole. Draw it well circumscribed. Draw golden yellow in color. And it is solitary, single, well circumscribed at the upper pole. That is the gross. Now coming on the microscopy. In the microscopy, first you have to see the classification of RCC, renal cell carcinoma. RCC, renal cell carcinoma. There are 4 types of renal cell carcinoma. What are the 4 types of renal cell carcinoma? Clear cell carcinoma, papillary carcinoma, chromophobe carcinoma, and collecting duct carcinoma. Chromophobe also known as oncocytic carcinoma, and collecting duct also known as Bellini duct carcinoma. So we will see the details of these 4 one by one. Clear cell, papillary, chromophobe, collecting duct. If we see the incidence, clear cell is most common, papillary is second most common, chromophobe is third most common, although rare, and this one is the rare of the rarest. The least common one. The least common one is the collecting duct. So we will see the details of all of them. Before telling you the details, they all are arising from the kidney. They all are arising from the nephron. So here is a diagram of nephron in front of you. I guess you know the parts of the nephron. This one is the Bowman's capsule with glomerulus. This one is the proximal convoluted tubule, PCT. After PCT, there is loop of Hanley. You can see this is loop of Hanley, the descending limb and the ascending limb, the loop of Hanley. After that, there is distal convoluted tubule, that is DCT, and after that there is